This was you on the day of your surgery.
Yeah, it's just, I feel so much better, miles better. If it's windy, walking down the street, like turning my head. After about 4 or 5 days, I was just up and out and back outside. Yeah, everything's changed for the better in terms of my confidence. Yeah, when I'm going out. I'd say the pain. I thought it was going to be a lot more painful than it was. Basically, day 1 do this, day 2 do this, day 3.
So welcome to Zentrix Hair Clinic. My name's Dr Riaz and this is our first long format YouTube video. Today we have
Harry.
Harry is one of our patients who is around 7 months post-op.
Yeah, that's right.
Okay, today we're going to be talking about your journey, Harry, from before you had a hair transplant to having your hair transplant and also the recovery and your results after that as well. So I'm going to let you take the floor. Let's get straight into it. Harry, tell me about your hair loss journey.
So I'd say when I was about 15, I noticed, that's when I first started noticing hair falling out, whether that was like a bit on my pillow when I was waking up in the morning or after a shower. And then it was pretty slow at first, and then yeah, gradually as I was getting to about 17, 18, I really started noticing more hair coming out, and yeah, it was obviously affecting my confidence and yeah, so I got to the point when I was in my early 20s that I wanted to do something about it, really.
Yeah, okay. That must have been quite difficult, you know, losing your hair at such an early age. It's more typical that we see male pattern hair loss in patients who are in their 20s, but I have seen it in many cases in patients who are in their teenage years, and I think that'd be particularly difficult. You know, as you're sort of progressing and going through life, you know, it's a key stage of life where you're meeting people, starting your career, perhaps starting a relationship.
Yeah.
So that must have been really difficult for you. How did it actually affect you?
It was probably, you know, when I say I'm playing football and stuff and my hair's flowing back and I'm like sorting it out, and then yeah, say I'm in the pool on holiday and then come out the pool and my hair's all wet and you can see my hairline it's like receding, and it was just things like that, really.
Yeah. So Harry, you play football professionally, and you sent me a picture yesterday. Can you tell me a bit about the picture?
Yeah, so I sent 2 pictures. The first picture was from well, it was last year before I had the hair transplant done, and yeah, my hairline's obviously really receded.
Yeah.
But yeah, that's what all the pictures in the games are like, and I obviously didn't want to post them on social media or anything because yeah, I was a bit insecure about my hairline. So yeah, and then I sent the second picture, which was from about 2 months ago.
Yeah.
Where my hair had, well, yeah, it was much better.
Since you've had the hair transplant, how have things changed?
Yeah, everything's changed for the better in terms of my confidence. Yeah, when I'm going out, just day-to-day life. Yeah, not having to, if it's windy, walking down the street, like turning my head. So I don't know. Yeah, my hair's not exposed and just stuff like that. You don't realise how much you were doing that, but yeah. So yeah, it's changed a lot in terms of my confidence and stuff.
It's so, you know, it's funny because patients come back all the time, they say the same things, and you've said 2 of those things today. So you've said wind and swimming pools as well.
Yeah.
And I think it's because obviously, you know, those are the times where you feel most vulnerable and your hairline can get exposed if you are suffering with hair loss. So again, you know, if it's bothering you, I'm of the opinion you should at least get some advice on what you can do about
100%.
it, and then make an informed decision.
Mm-hmm.
Harry, this was you. I'll blow this up on the screen if you're happy for me to share.
Yeah, no problem.
This was you on the day of your surgery. How do you feel looking at that now?
Yeah, it's just, yeah, I didn't really forget how bad it was. Like, yeah, I don't know. Yeah, I feel so much better, miles better, definitely.
So, right, Harry, what do you think about now that we've had a look at the pre-op images, how do you now feel about the hairline design? Yeah,
I'm really happy with it. Everyone who's seen it says it looks really natural, and yeah, it's exactly what I wanted, really.
Yeah.
So, yeah.
Do you understand why? So on the day of the surgery, we discussed the reasons behind why we need to be conservative and draw a more natural hairline, especially given your age, being in your early 20s. It's important to conserve graft numbers. Yeah. Do you understand the concept behind
you went through that thoroughly, obviously, and I understand that. Yeah, I could have maybe brought it further forward than it is.
Yeah.
But yeah, down the line, I will likely need another transplant. And yeah, there's only so many grafts you can take, isn't there? So
yeah, absolutely. And look, nobody's got a crystal ball where they can predict how your hair loss is going to progress, and whether or not you will need another transplant in the future. However, in somebody who is younger, we need to be really, really careful and sensible and plan for the future.
Yeah.
So if we draw a hairline sort of halfway down your forehead, or really sort of juvenile hairline, what will happen is that if you need a second or third transplant in the future, we've already used so many grafts filling that area that we're very limited on what we can do. That's when patients often find themselves in a difficult situation. If we're conservative, we draw sensible hairlines in younger patients, use a sensible number of grafts, that will set you up for success long term in terms of managing your hair loss.
Yeah.
The other thing that we talked about, and I'm going to touch on this now, is medications for hair loss and having a good prevention plan in place. So just for some context, the transplanted follicles, because we take them from the safe donor area, when we implant them here, they should last you most of the rest of your life. Unfortunately, the native hair, so the hair that you have on top of your head which isn't transplanted, is still vulnerable to the effects of DHT, which is the hormone that causes hair loss. Now, if we don't have a prevention plan in place, what happens is that over time, the native hair will continue to fall out. So if your hairline's receded up to here, we transplant the front bit, it will continue receding behind that if we don't stop it or slow it down.
Yeah.
Which is one of the reasons that, I was apprehensive initially to do a transplant in somebody who's quite young, was because of the potential of future hair loss. But the factors that made me comfortable with it was the fact that you were stabilized on hair loss medications, you didn't have any side effects, and your hair loss wasn't getting any worse.
Yeah.
So tell us a bit about your hair loss prevention plan.
So I've got the minoxidil and finasteride spray, and I've used that twice a day, in the morning and night, and I've not had any side effects from it at all, which has been good. And it's only takes a few minutes every day. And then also I've been having PRP sessions, and then I'm going to aim to do like 4 a year probably, PRP sessions, as well as the finasteride and minoxidil spray. That's what I'm currently doing.
What would you say is the most important component of the PRP, the finasteride and minoxidil?
From like the research I've done, and from speaking to you, I'd say the finasteride, because that's what blocks DHT.
Absolutely.
Which causes your hair to fall out. So,
exactly, yeah. I would agree with that. I think the finasteride, in terms of slowing or stopping down the process, is the key component of your preventative plan. Just the fact that you have answered that and explained it to me in terms of blocking DHT, it makes me so happy, because it means that I've done my job to a good level, and because you understand that.
Yeah.
And I just wish that patients who are going for transplants and who are suffering from hair loss actually understood this and had this explained to them, because it is so important in terms of long-term outcomes. I just want to touch on side effects. So were you worried about the side effects of hair loss medications? I
was slightly worried, mainly about a lot of people talk about how it can cause erectile dysfunction and low libido and things like that. So that was on my mind. But apparently, is there more cases in that when you take it orally than in the spray? So that's part of why I went with the topical.
Yeah, absolutely, you're right. So there are some studies which suggest that if you use a topical formulation of finasteride and minoxidil, there is a lower risk of getting particularly sexual side effects compared to taking the oral versions. Lots of patients, because of that perceived risk, will prefer to be on topical medications. Again, it comes down to each patient's choice. So what I will routinely do is discuss all of the options with the patient, discuss the risks of being on oral medications versus being on topical medications. And each patient's different. So I have some patients who will say, okay, I understand that the risk is higher when taking oral medications. However, I'm not going to be able to commit to using a spray twice a day. If I have, an all-in-one tablet that I can take, that would suit me better. In which case, the compliance is more important. The brand that you use is not particularly important. The main thing is having good compliance. So Harry, tell us about the day of the transplant, tell us about the day of the surgery and your experience around that.
Yeah, so the experience overall was good, apart from the injections, the numbing injections. But yeah, so I arrived in the morning, and then I spoke to you, and you went through the itinerary for the day and basically explained what we were going to do, and then you drew on the hairline, asked me would I be okay with this? Did I like it? Asked me if I wanted to adjust it, etc. And I was happy with it. And then we went on to begin the procedure. So.
Okay. Were there any parts that were better than you thought?
I'd say the pain. I thought it was going to be a lot more painful than it was, but it was more just a bit uncomfortable. But yeah, it was pretty pain free aside the anaesthetic injections. So
some patients have a perception that if you have a transplant and it's a 10-hour procedure, there's going to be pain throughout the day.
Yeah.
Whereas in reality, it can be uncomfortable, and sometimes patients find it painful, but only for I'd say maximum of 5 minutes when we are injecting the anaesthetic in the recipient area, and then another perhaps 5 minutes when we're injecting anaesthetic in the donor area.
Yeah.
After that, I think for the most of the day, it's relatively, you're comfortable, you're listening to music, you're watching TV. And I generally find that patients have a better experience compared to what they thought it was going to be like.
Yeah, I'd say the same. And then you're obviously constantly asking, like, can you feel this? Can you feel this? And if I say yeah, then you top up the anaesthetic. So yeah, it was literally pretty much pain-free throughout the whole day. Good.
And I can't remember what happened on the day, but did you watch TV? Were you watching?
You asked me, do I want to connect to the music? And I said, I'm not too bothered. And then you just put some music on, and then I ended up putting some TV on as well. So yeah.
During the rest of the day, the later parts of the day.
Yeah.
Okay. So a hair transplant, as you know, is split into 3 parts, and the order can vary depending on the surgeon. So we do extraction of the follicles, and then incisions where we make the recipient sites, and then finally implanting of the follicles. And that's with a typical FUE hair transplant. Which part was the best and which part was the worst?
The best bit was when you were putting the hair follicles back in the new area, because I don't know, maybe I knew it was coming towards the end, or but yeah, I think it was just the most relaxing bit. You could just sit there while it was happening. And I'd say the worst bit was probably when you're taking the hair follicles out. Yeah.
Why was that?
I don't know. It's probably the most uncomfortable part, I'd say. So yeah, I'm not too sure, but yeah, it was.
So from my experience, I'd say 90% of patients would agree with exactly what you've said. So implanting is probably the most comfortable part, and when we're extracting or harvesting follicles from the back and sides is usually the most uncomfortable part. Not because of pain, but because you have to lay, sort of face down in a similar position to when you're getting a massage. And you may have to be there for 2 to 3 hours, depending on the number of follicles that we're doing.
Yeah, that was the most uncomfortable actually. Just having to lie in a position for quite a while. Yeah,
and have your sort of head in different positions. Yeah. But that's one of the reasons why we encourage breaks. We send you out for lunch for some time, and I'll often encourage patients to come up onto their forearms and have a bit of a stretch or have a bit of a walk around. So once you had your transplant, how was your recovery?
The first few days, obviously having to use a saline solution, that was pretty annoying. Obviously having to get up every hour in the night to spray the solution on the transplanted area. The first 3 days after were a bit rough, but after that it wasn't too bad at all, to be honest.
And when could you get back to sort of normal activities?
After about 4 or 5 days, I was just up and out and back outside, really.
Yeah, so normally I say to patients, if you're sort of desk-based, and you can go back to work after 5 days, as long as you're not doing any heavy lifting or any sort of manual labour jobs, that's absolutely fine. And we discussed this on the day of the transplant, but my aftercare regime is slightly more intense than you might find with a different doctor.
Yeah, I found that really helpful. Obviously the pack you gave, and it was basically day 1 do this, day 2 do this, day 3 days like 4 to 5, and it was yeah, that was really helpful because I felt like I had some structure and knew exactly what to do each day. So
Yeah. So I always say there are three major factors that affect the outcome of a hair transplant. One is the surgeon, of course. Secondly is the surgical team, and thirdly is the patient. If we perform the best hair transplant that we can perform, and you or the patient go away and essentially don't take care of the transplanted area, your results will not be as good as they could be if you followed, the appropriate aftercare advice accordingly. So one of the reasons why I give quite intense aftercare advice is you're not going to be having a hair transplant every year, or it's not something that you're going to be doing all of the time. In a patient's lifetime, you can actually have up to five to six hair transplants, and sometimes even more, depending on the number of follicles that are already taken out. But if you're having this procedure done, my opinion is that we should do absolutely everything possible to give those grafts the best chance to survive and to thrive and grow. You don't want to invest all of that time and energy and money as well, and then not take care of the grafts as best as you could.
Yeah.
So I know, there's a difference of opinion in terms of spraying saline on when you should get the scabs off. My opinion is always that err on the side of caution, do as much as we can to help with that. If that means a little bit more effort, so be it.
Yeah.
How did you find the support after the transplant?
Yeah, it was good because obviously you gave me a personal number, and you checked up on me, and then I obviously asked any questions I wanted at any point. And you'd always reply obviously pretty fast. So
thank you. So I do. I think it's important that you, after you've had a surgery like this, you might have questions. You might, in some rare cases, there can be complications as well, which is why it's so important to go to a doctor or go to a clinic where you can have access to aftercare support. The reason that I have such a robust support system in place is because I genuinely want to know. So if you've got a question, or if something's going wrong, or if there's any early signs of infection, I want to know so that we can do something before it gets to the point where it may affect the result.
Yeah, I remember when it might have been after about 4 days or something, or 5 days, and there was just one scab that was still there, and I shouldn't have, but I picked it a little bit, and then it was bleeding, and I sent you a picture, and then it was like 9 or 10 at night, and you rang me straight away telling me what to do and stuff. So
yeah, okay, fine. I've completely forgotten that, to be honest, but it's really important. I can't emphasize enough how important it is to make sure that not only are you going to a surgeon and clinic who care on the day, but also who will care afterwards as well. Aftercare is such an important part of getting a good outcome.
Yeah.
So one of the things that I wanted to discuss, and I think it's interesting for us to talk about, is the challenge that we had on the day of the transplant with the direction of hairs.
Yeah.
What do you know about this?
So I remember you saying, I can't remember what it's called. Is it a cow's lick? Or
a cow's lick, yeah.
And obviously the direction in which my hair grows out is not the normal way, basically. So yeah, there's a bit of a challenge when you were implanting the hair follicles, making sure they point the same direction as like where my hair currently points, basically. Is that right?
Yeah, pretty much. It's exactly right, yeah. One of the key parts of getting a good hair transplant, or getting a good outcome, is following the direction of the native hairs. So when I'm making the incisions, it's really important that I'm not just making them in one generic pattern, but I'm looking at the direction of your hairs and following those directions.
Yeah.
Normally, in most males, hair grows in a forwards direction. So when I'm making the incision, the hair will come out sort of forwards like that, and then slightly splay towards the sides as we move towards the temples. The direction of hairs in your case, and I'll try and put a picture overlaid on this, was slightly unusual. So the hairs were growing out and laterally to the side, and then coming back down.
Right.
So when I was making the incisions, I was sort of breaking my back and my wrists trying to follow the direction of the hairs.
Yeah.
But as one of my good friends and a great surgeon, he's called Dr Ahmed Riaz, he said something to me once, and it's stuck with me ever since then. It's all in the wrist. To follow those directions, you need to bring your wrist round and make sure that you're trying to get them as perfect and in the same direction as the natural hairs are. Because otherwise what will happen is the transplanted hairs might be growing forwards, and your native hairs will be growing to the sides, and if everything's going in different directions, you're not going to get a natural result.
Yeah.
One of the concerns that patients often have is about scarring after an FUE transplant and what that might look like at the back and sides of the scalp. How have you found the scarring at the back and sides of your scalp?
Well, yeah, you obviously mentioned that before I had the transplant done the morning of that. Yeah, I always get a skin fade. Obviously, I've not had my haircuts tomorrow, so I've not got one in a minute. But yeah, you mentioned that I would probably have scarring. And yeah, you'd probably be able to see it if I had a skin fade. So I was a bit conscious about that. But then yeah, the next time when I was able to get my normal haircut, my barber said that he couldn't believe it. Basically, he was blown away that I had no scarring at all. And yeah, he said I had the least scarring he's ever seen from a hair transplant. So
wow.
Yeah, that made me feel really good as well.
That makes me feel really good as well.
Yeah.
Okay, so just to get into it, there's no such thing as no scarring with a hair transplant. So by definition, when we cut the skin and we extract the follicle or excise the follicle from the back and sides of the scalp, we will cause some level of scarring. It's my job to ensure that that scarring is as minimally visible as possible with how many grafts we need to take. So let's say if you have 5 hair follicles in one group, we might take 2 or 3 and then leave the 2 behind so that we can cover the area so that the scarring is as minimally visible as possible. One thing that I have seen is hair transplants being advertised as no scarring or hair transplant without any scars. That's simply not true. By definition, when we make a cut into the skin, we cause scarring. How much scarring you have, how visible it is, often comes down to, number one, the skill of the person who's performing the procedure. Secondly, the punch size in an FUE transplant anyway, the punch size that we use.
But yeah, the first like 1 to 3 months, I think that's probably the worst part, to be honest, because obviously the follicles fall out, don't they?
Yeah.
And it sheds. So that first stage is a bit like, yeah, when you don't really want to go out much and stuff, and you wear a cap quite a bit and stuff like that. But after that, after month 3, well, when they started coming through, yeah, I wasn't too bothered about going out or anything. Yeah, so
yeah, it can be quite disheartening because you've got all the transplanted follicles in. Once you remove the scabs, you've got all of your tiny hair follicles.
It looks looking all right,
and it looks good, right? And then unfortunately it falls out. I think yours, we managed to retain a lot of the hair shafts in place. We'll try and put a picture of around day 10. We'll try and overlay that picture. But it can be quite disheartening when you're going through that. Some people call it the ugly duckling phase of the hair transplant follicles or the shedding phase. It can be a bit disheartening, and I've had patients call me in the past and say, I've spent all this time and money and effort getting this done, and now I'm no further forward than I was.
Yeah.
But obviously, that's why, as part of the aftercare pack, I always give patients a trajectory of what to expect. So, sort of 10 days post-op, all of the hair shafts will be there and the scabs should be removed. Then the hairs start to fall out, or we go through the shedding phase, and then growth starts from month 3 to 4 onwards.
To be fair, with me as well, it was quite good because it was before month 3 where it started coming through. So.
Wow, okay, that's really good.
Yeah.
Good. And then generally we say by month 6 you're at 50% to your final result. You being at month 7, I still think that there is still room for improvement as the hairs continue to work through the hair cycles. They'll become more natural and should start to feel a bit more natural and perhaps more dense as well.
Right.
Before your hair transplant, when you were suffering with hair loss, were there any situations where you felt particularly self-conscious about your hair?
It was probably, like I said, about when I'm out and it's raining, like that would make me feel really conscious. I was like trying to get inside or cover my hair basically, because it exposed the area where I'd receded a lot. So say like rain, and then also like the wind, that was just a massive thing, turning my neck and stuff when I'm walking. So but yeah, it was just things like that. But I was obviously aware, and I was thinking about this a lot, about say a year down the line, if I hadn't had the transplant when I did, I was like, imagine how much my hair loss, how much more hair loss I would have had, and thinking, I wouldn't even be able to hide anything at all at that point. So it was starting to stress me out a bit.
Yeah, okay, well that's really nice to hear. Obviously we've stabilised the hair loss and added more hairs, and it's great to hear that you feel much more confident now.